Hello, Chad here, doing my VSG update. Today is Tuesday, March the 17th. Let's start off by where I came from. Surgery date was February the 19th. Will soon be a month. This Thursday will be a month. 2 more days. High weight was 310 pounds before I started the pre-op diet. 290 pounds was my surgery date, and now I'm at 270 pounds. Was morbidly obese, and I've dropped into the just plain old obese category, and tell you the truth, it feels pretty good. Weight loss was pretty dramatic during the pre-op and right after the surgery. Of course, you know, you're not eating anything, so... And I didn't expect it to continue at that rate, and I didn't want it to either, because I'm pretty sure I was cannibalizing muscle. My weight loss has slowed down now to about a pound every 2 days. I'm very happy with that. If you put the numbers to that, that's a lot of weight over the course of 6 months to a year. I'll have no problem getting my gold weight of 200 pounds within the first year, no problem at all. Water intake, I tell you, water intake has been no problem for me. It has had a recent change, though, I want to tell you about. When you start eating soft foods, and I started eating them last Saturday, it changes your water intake simply because, in my opinion, you're blocking your plumbing with food. After I eat, I find it restricted on how much water I can drink. I can't drink water as freely as I did before. So what I do is now I've started just doing for breakfast, rather than eating a solid food, I'll eat a protein shake for breakfast. Mix it up with a lot of water. I generally mix my protein shakes with 26 ounces of water so I can get the water intake. And then drink water after that. Try to get all my water, which I still drink freely in the morning, before lunch. Get most of my water intake done then. And then after I start eating, I just sip on water, because after I eat, I do feel myself restricted on water. It doesn't go down nearly as easy as it did before. So what am I eating? During the soft food phase, I'm eating things like chicken thighs. There's a long list, long list, not long enough, but there's a list that Dr. Alvarez lets you eat. Chicken salad, tuna salad, chicken thighs, refried beans, yogurt, things like that. I'm eating a lot of chicken. I'm a big chicken fan. I think it's good protein, no carbs, things like that. I even had some chicken nuggets, my little daughter's chicken nuggets yesterday. I chewed them up real good though, because it's actually not on the list, so don't be too disappointed, Dr. Alvarez. I chewed them up well. So that's what I'm eating. Weight loss has slowed down. That's okay. 1 pound every 2 days. Very happy with that. Continue to get the pounds off. I'm 40 pounds off so far and feeling good. Talk about some of the possible negatives that could happen. Well, even though they're not really happening to me, wound care has not been a problem. The stereo strips, they eventually fell off. They were itching a little bit, which tells me that the wounds were healing. They ended up falling off in the shower, and no problems. I didn't really put anything on them. Other than they just really took care of themselves. No issues. No issues with leaks, of course. I'd be in the hospital if I did have a problem with a leak. I think most people that have problems with leaks are do something stupid, like eat something solid or something that they shouldn't eat before before it's time. Gas pains. Gas pains has really not been a problem for me. I got my butt up out of bed as quick as I could after the surgery. I think I was a couple hours after surgery. I got up and started walking, and I was pretty religious about walking the day of surgery and the second day after surgery, and I think that benefited me a lot. So get your butt up and get to walking, and that way you don't have to worry about the gas pains. Nausea and vomiting. Last video I told you I had some trouble with nausea the day of discharge, and really that was the only day I did. Haven't had any problems with nausea and vomiting. I will tell you that that day of discharge, it was because I think I got nausea because of the smell. And the hospital doesn't stink, don't get me wrong, but my sense of smell was so hyper acute. I don't know if it was anesthesia or if it was the pain meds or some other medication, but it was hyper acute. Everything smelled to me. My poor wife, I hurt her feelings, I think. Her perfume just didn't smell good to me. Her breath, my little baby girl's breath. I mean, step back just a little bit, okay? But it wasn't just that; it was everything. Everything smelled differently. Now that's gone away. It took about a week for that to go away, and I'm back to normal. But wow, that first week, my sense of smell was so hyper acute. My dog just turned my stomach. But no nausea and vomiting after that first day. Heartburn, no problems with heartburn. They give you a 10-day supply of acid blockers. Take that stuff religiously. Finish it. And since then, I've been on a Prevacid in the morning and a Prevacid at night. If I feel a little acidy or something, I'll pop a Rolade or something like that. But what I'm trying to do is keep from having a problem. And, having acid in your stomach also gives you, I think, a sense of hunger. Also affects what you can eat and stuff like that. I'm planning on doing after this first month, which is coming up in a couple of days, I plan on dropping down to 1 Prevacid. And then after another month, I'll probably not do any Prevacid and see how I do. Stools, my BMs have been no problem at all. Of course, I hadn't been eating very much food. But the bowel movements, no diarrhea, and no constipation. I've got the Metamucil and the stool softeners and stuff like that on hand just in case, but it hasn't been an issue for me. Hair loss, I've got thin hair anyway, so it's not a big deal for me. But I will tell you that I have not had any big clumps of hair coming out of my head. I do take all my vitamins, and I do take all of the biotin and get plenty of protein. So maybe I won't have any problems with hair loss. I do watch all that stuff very closely. But if I do, a lot of times I don't even have this much hair. A lot of times I'll wear a buzz or shave it, or a zero with the clippers is pretty much like in shaving your head. And sometimes that's what I wear. So if I have a problem with hair loss, I'll just be done with it. Regrets. I always wanted to hear people's regrets of the surgery. Well, if you're looking for me to give you a bunch of regrets or a bunch of horrible things, I don't have anything for you. I have noticed, a lot of people talk about being cold. I have noticed, that I'm a little colder than I was before. But what do you expect? You're losing all your insulation, people. I mean, of course you're going to be cold. It's going to take a while for your body to get adjusted to not having all that insulation on your body. But things are really good. I don't have any regrets whatsoever. I've made it up in my mind that that I'm going to do this, and I'm going to make the commitment to eat the protein and produce, people. If you're not willing to that's the only thing I can tell you to steer you away from having this surgery. If you're not willing to make the commitment to eating protein and produce the rest of your life, then don't do the surgery, people. Don't do it. Because if you're not going to change the way you eat, you're just going to be miserable. Because you can't eat the way you used to. I've made the commitment, and I'm ready for a lifestyle of the way I should have been eating all along. I know I have to eat now to be successful and make this work. Because people do get fat with a sleeve. You can eat ice cream and cookies all day long and gain weight with a small stomach. And if that's what you want to do, just keep your big stomach and be fat and happy. But I know that I was not fat and happy. I was fat and miserable. Have been a long time, and I feel better now about myself, my body, my everything I just feel so much better. I know my life's going to be better. My family's going to be better. My job as a firefighter is definitely going to be better. I can't steer you away from this surgery. The only way I could is if you're not willing to make the commitment. Things are good. I'm happy, and I hope that's refreshing to you if you're deciding to make this journey. Thanks for watching. I'll post again if I don't know when I'll post, but I'll post again, let you know how things are going. And until then, let's lose some weight and get healthy.